The broadcast is now starting. All attendees are in listen-only mode.
Then I can still see your slides, so you're good to go.
Great. Hello, everybody. My name is Ann Potempa, Public Health Communication Specialist with the Alaska section of Chronic Disease Prevention and Health Promotion. We created our webinar series to provide a way to talk about our projects and explore how we can work together. The webinar is planned for 30 minutes and allows time for questions and answers. A recording of today's webinar will be sent to all participants. Audio for this webinar will come through your computer. Another option is to call the number provided when you registered for today's session. If you are listening by phone, please keep it on mute. Please do not put this call on hold. If you receive a call, please hang up and call back in later. Please hold all questions until the end. If, however, you are having trouble hearing or seeing any of the slides, please let us know right away on the chat box. To ask any questions, please type into the chat box on the control panel. Let's get started. I'm going to turn off my camera while I present, but when the webinar is concluded. The webinar today focuses on the newest direction for our section's Play Every Day, which turned 10 years old this year. We started building it in 2011 and it launched across the state in early 2012. The long-term goal of the campaign is to help Alaska children grow up at a healthy weight by getting daily activity and choosing healthy foods and drinks. In Alaska, children live with overweight or obesity. 2 out of 3 Alaska adults live with overweight or obesity. Over a lifetime, obesity increases people's chances of weight-related diseases, including type 2 diabetes, heart disease, and many types of cancer. We also know that obesity, diabetes, and a lack of regular physical activity are all chances for serious outcomes from COVID-19, which can mean hospitalization or death. That reinforces the importance of a healthy weight to help you fight infectious diseases like COVID, but also to prevent longer-term chronic diseases and stay in the best health for a lifetime. We run Play Every Day through the Alaska Department of Health and Social Services. We specifically manage it through our section's physical activity and nutrition program. Over the years, we've had key partners that helped share our messages, and those include the Alaska Native Tribal Health Consortium and the nonprofit Healthy Futures program that provides a free physical activity challenge to elementary school children. Today, I'm going to talk about using all of to reach our audience. I'm going to talk about our current focus to improve nutrition in the first 2 years of life. I'll talk about our campaign to promote healthy drinks, not sugary drinks, and how we learn from our audience and develop materials. Then I'll talk about our evaluation. Our plans for the upcoming year is to continue advancing toward our long-term goal of helping Alaska kids grow up at a healthy weight. We'll be running our campaign year-round to support daily physical activity during the pandemic and to reduce consumption of sugary drinks. We'll focus on our priority audience, which is Alaska parents of children in preschool and elementary school. And we'll use research to both inform and evaluate our work. We are in the process of a 2-year evaluation of our messages, and I'll talk more about that later. Play Every Day shares its educational materials through many routes. Right now, we have 2 30-second video public service announcements, also called PSAs, running on television, online, and through social media. We have online messages focused on play, healthy foods, and drinks. We post daily Facebook posts. We publish blogs on our website, which is playeveryday.alaska.gov. We distribute posters and handouts to schools, preschools, childcare centers, and healthcare providers. And we send regular emails about blogs and materials through our Play Every Day listserv, and those are ready. From the beginning, our primary audience of focus has been Alaska parents of young children. We started with parents of kids ages 5 to 12, but have broadened that recently for 2 key reasons. One is we are a recipient of a CDC grant called the State Physical Activity and Nutrition Grant, and that focuses on several objectives. One of that is improving physical activity and nutrition in childcare and preschool settings. We wanted our public education campaign to align with that objective. So we reached that same audience by focusing our newest messages on those that will speak to Alaska parents with 3 to 5-year-old children at home. We also know that when it comes to building healthy habits, it's best to start early. In December 2020, the new dietary guidelines for Americans came out with a recommendation for no added sugar for toddlers in foods or drinks. In the past couple of years, Play Every Day has started filming and focusing on younger and younger children, including preschool age children. This year, we even filmed with children ages 2 and younger. I'm going to share this new message that includes Alaska toddlers and focuses on the new guidelines for serving them foods and drinks without added sugars. Through this video, we focus on showing instead of telling. We showed what the healthy behavior looks like rather than just tell parents what a healthy guideline wants them to do. We know parents are seeing and hearing lots of messages about all kinds of topics every day, and we want our messages to break through, to reach and speak to these parents, to be remembered and to be acted on. We always keep that in mind when we're filming and creating new materials. Here's the first public service announcement.
Those first couple of years are all about trying new foods and drinks, taking the taste buds for a test drive. Without realizing it, we can easily serve our little ones added sugar. Sugar sneaks into toddler milks, fruit drinks, squeezable snacks, yogurt, cereal, and more. We can still give our toddlers easy-to-grab options that are healthy. Choose foods without added sugar. Serve water or plain milk. Choosing healthy doesn't have to be hard.
And if that happened to buffer on your end, I have the web address here below. Our YouTube channel is Play Everyday AK, and I also have the specific web address in the slide. I'm going to share another message with you that we have created this year, and that is one that we tested in a focus group in concept in recent years. And we tested a behavior change practice that is often taught to parents of toddlers or preschool age children. We know children want to be in charge of their choices, and there's a way to give children choices, but also to help the whole family move to an acceptable choice quicker. Here's how it goes. Kids want to be in charge of their choices. Knowing that, parents can give them choices, but limit them to 2 healthy ones. Then the child is empowered to make a choice. The parent is happy either way. And if both choices are healthy, the child will make the right choice every single time. Here's that public service announcement.
Here's what parents want: to feed little kids quick and easy. Here's what kids want: to be in charge. So give them 2 choices. Grab and go doesn't require added sugar, so make both choices healthy. Here's whole grain crackers or some cheese. Thirsty? Do you want water or milk? How about a small orange or some unsweetened applesauce? It's great to give our kids choices. If all options are good for them, then kids will make a healthy choice every single time. Here's what parents want.
In focus groups, we'd hear from parents that one of the real-life barriers for them in terms of serving their kids healthy foods and drinks was convenience. It was important for them to have options that were quick and easy to grab. So we needed to help families learn about these easy-to-serve options that were healthy but had no added sugar. We talked with our registered dietitian on our staff and read labels on items across the stores. Then we showcased these easy grab-and-go options that are also healthy. Unsweetened yogurt instead of sugary tubes of yogurt, unsweetened fruit and vegetable purees in pouches, slices or string cheese, whole grain crackers and cereal, small fruits, and cups of water in plain white milk. One technique we use in our campaigns is to start with short, easy to understand messages and then build on it for families who want to know more and have the interest in digging deeper. We created these 2 short video PSAs and dozens of short social media posts that broke those messages down into a sentence or 2. Then we launched the campaign with longer format communications to help explain the why behind the messages. We focused on how these messages share the new dietary guidelines for Americans about serving foods and drinks without added sugar to children younger than 2. We wrote and shared this blog at the end of July 2021 to share the toddler's public service announcement. Then we did it again, writing and sharing a blog to explain 2 choices and how families could put it into practice with their own children. We also have a great tool called Gov Delivery, which is a free listserv that any Alaskan can sign up for by just adding their email address. Every time we update the Play Everyday messages, I can send this listserv an email message. That's how you see the blog shared in this slide. With 1 email, I can share our public health message with thousands of Alaska families, and they can share it by forwarding the email to others. It's a great way to share materials with partners too. We always try to find where our audience is listening, watching, and reading through TV, radio, online, on social media, walking down school hallways, or waiting in a pediatrician's or dentist's office. And then we expand our message there. We have a Facebook page that you can find at Play Everyday AK. We've been there for years, and we're getting closer to 14,000 followers. We post to it almost every day to ensure Alaska families can receive shorter versions of our messages and then share those with others. You'll see that our video public service announcement has been converted into social media posts that we share. We do the same on our Instagram page, which is also Play Everyday AK. We know Alaska families are online and they're visiting websites. And we try to ensure messages are being shared on those websites that they regularly visit. To do that, we've converted our messages into online formats. When you're on our website, you will see still frames that rotate like this to share the whole message. This is the online format of our toddler public service announcement. And here is one that we've built for our 2 choices message. Over the years, we've built a series of posters focused on serving healthy drinks instead of sugary drinks to families of kids of all ages. We have many of these in our office and are more than happy to mail them or share them to hang in schools, doctors or dentist's office, childcare centers, preschools, or other places that families visit. When I started the webinar, I called Play Everyday a social marketing campaign. That term means it's a campaign that goes beyond raising awareness about a health issue. Its goal is to improve knowledge about that health issue and then ultimately positively change behaviors that relate to the issue. So in our case, Play Everyday's messages are geared toward increasing parents' knowledge about what a sugary drink is, it's not just soda, and about how much sugar is hiding in these drinks, and why serving water or plain white milk can improve health outcomes over a lifetime. Our messages are also focused on encouraging families to make that behavior change, to cut back or eliminate serving sugary drinks and to serve water or white milk instead. Running a social marketing campaign requires following a process, and part of that process is informing the message on the front end and evaluating the message later. We inform our messages by choosing an audience of focus, Alaska parents of young kids, and making sure we're listening to them and learning from them. We're evaluating our messages to make sure they're reaching our audience, but more than that, that they're leading to positive changes. We've held dozens of focus groups across Alaska since we started Play Everyday 10 years ago. We've learned from some parents that certain sugary drinks seem better, maybe healthier to them than others. That applies to vitamin drinks and sports drinks, to fruit drinks and chocolate and flavored milks. All of these drinks have added sugar, sometimes much more than parents understand. A 20-ounce vitamin drink, for example, can have 8 teaspoons of added sugar. A fruit drink may not have any real fruit juice in it at all. Instead, it can have just as much sugar as a soda. We've also heard from some parents that they start serving sugary drinks to kids at a very young age, 1 or 2, maybe even younger. We use what we learned from Alaska parents to create messages that improve their understanding of drinks, what drinks are actually healthy drinks, and the importance of serving these healthy drinks to their families. It's important to evaluate social marketing campaigns like Play Every Day to ensure you're reaching your target audience, to improve knowledge and positively change health behaviors. That evaluation has looked different year to year for Play Every Day, depending on a number of factors that include the audience we're trying to reach. We're fortunate to have an ongoing survey already in place that helps us evaluate our current messages. For 2 years, we are including a set of questions on the Alaska Childhood Understanding Behaviors Survey, also called CUBS. It's run through our Division of Public Health section of Women's, Children's, and Family Health. It's a great match. Our current communication materials are geared toward Alaska parents with toddlers and preschoolers at home. This survey is filled out by Alaska mothers of 3-year-old children. It's a systematic survey with a strong history in the state. We've added our questions in early 2020, in July 2020. To date, we have preliminary results from 448 surveys collected between July 2020 and March 2021. First, it is sent out in a print format. The mother fills it out and mails it back in. If a mother receives a survey and doesn't return it, reach out by telephone to see if the mother wants to fill it out over the phone. As the surveys are completed, we'll be looking for any differences in answers depending on if the mother filled out the survey by mail or by phone. This is how the questions appear at the very end of the survey. We need to recognize that a parent's time and attention on surveys is limited, and we are adding to an already established set of questions. We were able to add these questions, which are small in number, but hit all 3 key areas of evaluation for us. Question 64 measures reach to our audience. Question 65 measures knowledge. Did our messages with their other people? And did they ultimately make parents serve their 3-year-old children? So far, we've been able to look at responses from 448 Alaska mothers, and I'm going to share some of those early findings. I want to remind everyone, though, that these are preliminary, and we'll be continuing to study these findings and add to them as more surveys are analyzed during the 2-year period of this evaluation. We do know that many parents of young children are seeing Play Every Day. 38% had seen the Play Every Day campaign about sugary drinks in the past 12 months. Many parents who had seen the campaign responded positively, including saying they changed their behaviors. 39% said it gave them new information about drinks they served their kids, and that they talked about or shared these messages with other people. 25% said they changed drinks they served their 3-year-old because of the campaign. That's 1 out of 4 parents seeing the campaign and changing the drinks they serve because of the messages. That is the ultimate goal of our campaign, positively changing behaviors. We're seeing some parents do that now, and we hope to keep building on that. We're also seeing that important groups of Alaska parents are responding to the campaign. I am noticing that some people are not hearing audio right now. Arthur, can you come on and tell me if you are hearing audio on my end?
Yeah, I'm hearing it.
Audio. Audio is back on. At the end of this, if there's any slide that did not come across, I'm more than happy to repeat it. So at the end, let's remember to do that. I'm going to start at the top of this slide again. We are seeing important groups of Alaska parents are responding to the campaign. Overall, mothers who said they learned something new and made behavior changes due to the campaign were more likely to be younger, have less education, be Alaska Native, live in rural areas of the state, and be more likely to have a child enrolled in social support programs. An example of a social support program is the Women, Infants, and Children Program, or WIC, that provides healthy food, nutrition, education, and more to families who qualify. We call these important groups about sugary drink consumption among Alaska families based on this same survey. This bar chart of recent Cubs data shows that we to consume a sugary drink every day if they live with mothers who are younger, Alaska Native, or have lower incomes or lower levels of completed education. Though it's not pictured in this bar chart, we also know that sugary drink consumption among 3-year-olds is higher among families living, including in southwest parts of Alaska. The fact that these groups also reported the most response to our Play Everyday campaign is very encouraging. Our early analysis shows that Alaskans were also more likely to change their behavior. 62% of moms who said they learned something new had shared information. 49% of moms who learned something new said it changed what drinks they served their children. An early finding that we are still exploring shows that moms whose children did not have visits to a healthcare provider were more likely to learn something new or to share campaign information whose children did have these doctor's visits. That shows the importance of campaigns like this, because these campaigns and their messages provide one more way to share important health information with families who may not be receiving it in a doctor's office. We know that during the pandemic, it's been hard for some families to have regular visits with their doctors, so it might be more important than ever to get these messages out. There are several online. Our main website is Play Everyday. I will note that our website, along with the health department's website, has been down. This is working to fix that, and we hope the website will be restored soon. The campaign does, however, have currently operating social media pages on Facebook, Instagram, and YouTube. Follow and share those pages and posts. They are all Play Everyday AK. When the website goes online, physical activity resources, all available for free download, and all drink, milk, and water resources available for free download and sharing. Thank you for joining this webinar today, and thank you for the continued support sharing our messages. We are more than happy to mail any of these materials to you. We can also build thumbnails, preschools, or waiting rooms at doctor's offices. Please don't hesitate to reach out to me by phone or email to ask for what you need. We can mail these out, or if you are in the Anchorage area, your offices to receive these. Feel free to reach out to me in the future for any questions. And thank you very much for your time today. I am going to come back on camera, and I'm happy to take any questions. Arthur, if you could help me look through any that have come in, that would be great. And any of those slides could not be heard or seen due to technical difficulties.
Yep, at the moment I don't see any questions in the chat right now, but I will let you know.
Sure, thank you, Arthur. And while we wait to see if any questions come in, I'll just remind you that we will send out these slides and a recorded webinar to all registered participants. So even for those who could not be on all of this talk or some of this talk, we will be sending that out again. When our website goes online, we'll be putting the materials online to share for the future on our webinars webpage. Again, the campaign website is at the bottom of the slide, playeveryday.alaska.gov, and our Facebook, Instagram, and YouTube can be found at Play Everyday AK.
Well, it doesn't look like we have any questions so far, but we do have a great job, nice work from Carol. And then Gretchen said, many thanks for the survey results, very impressive.
Yeah, it's been really important for us over the past 10 years to come up with ways to evaluate the campaign. And this is the second series of surveys that we've done, and we're really looking forward to see what this shows over the next 2 years. Again, we're just about a quarter of the way through gathering all the surveys for that, so please watch for some finalized research results to come out in the next couple of years. Thank you, everyone, for the nice comments. I appreciate all the support for this campaign and all the other campaigns that our section runs. And again, please feel free to reach out to me. Like I said, we have all kinds of printed materials in the office, and I'm more than happy to package together and mail out, or you can stop by in Anchorage and pick them up. And we have definitely shared our public service announcements on discs, on thumb drives, and they're being shared in waiting rooms in clinics across Alaska. So thank you for that. Great, well, we will be ending this webinar, and like I said, we will be sharing this with you, and please look for announcements in the future for our next webinars. We'll be giving one in November from our tobacco prevention program, sharing some of the communication resources they have created. So please look out for that announcement and see what else we're creating, and please share with your partners. Thank you very much.